This is a model of a right knee. The femur is the thigh bone here. This is the tibia and the fibula. And in front of the knee here is the patella. This tendon up top is the quadriceps tendon, and the tendon down here is the patellar tendon. The kneecap is the biggest floating bone in the body. It serves as a fulcrum to magnify the force of your quadriceps when you extend your knee. It rides in this groove here on the femur. That's called the trochlea. That's the trochlear groove, and that groove there. And this is the patellofemoral joint. The kneecap is also known as the patella, and the femur is here, so that's the patellofemoral joint, part of the knee joint. You can push the kneecap to the side. You can see the inner parts of the knee. These round rubber gaskets, one on the outside, one on the inside, are the meniscus. The one on the outside is called the lateral meniscus. Lateral is a fancy word for outside. And the one on the inside is called the medial meniscus. Medial is a fancy word for inside. They serve as shock absorbers, and they look and feel like rubber. And as you get older, they get more brittle. Like an old rubber gasket in your car, and can wear out, and you can have a tear of your meniscus. In young people, violent trauma can cause tearing of the meniscus as well. And these things can, once they tear, flip back and forth and cause catching and locking of the knee. And the blue here is the articular cartilage. That is the slippery, smooth coating of the bone, and that lets one bone slide past the other bone easily. Now, arthritis is wearing away of the articular cartilage, exposing the bare bone underneath, like wearing tread off a tire or Teflon off a frying pan. The major ligaments of the knee are shown here. This one in front is called the anterior cruciate ligament. Anterior is a fancy word for front. The one in back is called the posterior cruciate ligament. Posterior is a fancy word for the back. And they call it cruciate because they cross each other. On the inside here is the medial collateral ligament, and on the outside here is the lateral collateral ligament. So there's four major ligaments that control the stability of the knee: the two cruciate ligaments in the middle, and the medial and lateral collateral ligaments. So when you have an athletic injury, say the ACL is torn, that affects the stability of the knee. That lets this bone, the tibia, translate to the front, and lets the knee give out when you're trying to do sports. If you tear the inside one, the medial collateral ligament, that lets the knee open this way and gives you instability that way. Lateral collateral ligament. If you tear that, that lets the knee open that way. And the posterior cruciate ligament, mostly in back here, if you tear that, that lets this tibia go backwards. But those are the four ligaments of the knee cap, the articular cartilage, and the meniscus.